Dear ladies, I urge you to start doing these exercises right away now if you want to live a full and healthy life. As a doctor, I see that every woman, sooner or later, faces problems like pain in the shoulders, pain in the sacrum, lower back pain, urinary incontinence, prolapse of internal organs, and inflammatory diseases of the urinary tract and genitals. This includes joint issues, inflammation in the vagina, uterus, ovaries, the appearance of benign tumors in the uterus and ovaries, as well as sexual dysfunction, inability to reach orgasm, dryness, and heaviness in the legs. And all these problems come from a single cause. It is a weak pelvic floor. And in this video, I will show you several exercises that work all the pelvic muscles, build them up, improve blood circulation, and vein health. There are a lot of nuances, so I recommend you watch this video until the end and do each exercise with me. And as a thank you for such a pleasant result, I'll be waiting for you to like and subscribe. Alright, here we go. Why is the pelvic floor so important for women's health? Let me just show you the anatomy. You can see the pelvic muscles here. On the side, these are the handles of the pelvic muscles. Inside, you see the cavity. This is the small pelvis, where the pelvic organs are located. What organs does a woman have there? Well, in the center you see the uterus. The uterus with its attachments. If I lift it up, you can see that the bladder is closely connected to the pelvic ligament apparatus. See the white part? That's the powerful pelvic ligament apparatus. All the internal pelvic organs, the rectum, the bladder, and the uterus are closely connected to these structures. That's why a feeling of heaviness often appears in the shoulder area. Sometimes it can even make it hard to take a deep breath and shoulder pain may develop. All of this happens because the ligaments and fascia become very rigid in this area. Spasms occur in the tissues and swelling appears. Swelling and spasms in the tissues disrupt the regeneration of the area. Inflammatory processes develop, which can lead to the onset of diseases. The fact is, fasciae are very sensitive to stress. If you look at animals, what happens when they get excited? Pets often stretch, stretching out on the floor. And this can cause tension in the facial system because it's the facial system and the ligamentous apparatus that are connected to emotions. Any unknown emotions or experiences create tension in the facial system. As a result, if you notice, when you experience emotions, what happens to your body? The body starts to relax. So, the shoulder area is significant, especially for such basic instinctive things as fear, anxiety, instincts of self-preservation, and procreation. And that's why all fears are registered in this system. The fascia, which compacts this tissue. These ligaments, of course, work in sync with the muscles. And if we look at the shoulder area is a multi-stage structure that includes ligaments and fascia, as well as many muscles, because as you can see, the muscles are shown in black, and look at the number of muscles in the back. These are all shoulder muscles. It's like a collar that supports the internal organs, and what really happens in the shoulder area is a vascular spasm, which disrupts blood circulation and affects the internal organs. And because of this, many different diseases appear. Ligaments and fascia start to push against each other, which leads to the retention of substances and disrupts the conduction of nerve impulses, and the muscles become more paralyzed. In other words, they start to function worse. They can even be in a state of spasm, but their ability to contract and relax properly is lost. It's the same if a muscle is completely relaxed. It also has trouble contracting. That's why normal muscle tone is very important, because both hypertonia and hypotonia are bad. So, this kind of dysfunction occurs, which results in vascular spasm, the appearance of venous congestion, tension in the ligament apparatus, edema develops, and the muscles start to contract and function poorly. This leads to the fact that substances begin to accumulate in this area. And when a lot of substances accumulate in the tissues and the organs become heavy, this starts to press on the pelvic floor under the influence of gravity and gradually relaxes the paralyzed muscles. And as a result, everything starts to sag. As a result, urinary incontinence and prolapse of internal organs also occur. It can even happen that the organs drop significantly. Complex work needs to be done here. Here, on one hand, it's necessary to strengthen only the pelvic muscles, but at the same time, you need to work with the entire facial system to detoxify and improve blood circulation. If you go through all these stages, you'll get a much better result than if you just do lifting. Pelvic muscles. And now I'll show you a few exercises that will help you work with the smooth facial system. They will increase the pelvic planes and improve blood circulation in the pelvis. This way, you'll get the maximum health benefit for your your pelvis. The first exercise we're going to do is the gluteal bridge. We need to engage the pelvic planes and strengthen the muscles. We'll do it 15 times, holding the top position for 5 seconds. Here, you should feel your gluteal muscles activating. The tension in the perineum rotates. You should feel warm. Gradually, it appears in the pelvic area. The gluteal muscles start to strengthen, reinforcing the shoulder position so that the stomach doesn't sag. Because if the gluteal muscles are weak, the stomach starts to sag, and gradually you feel more warmth in this area. So we keep doing this exercise, the glute bridges. After this, we move on to the second exercise, which is the sandwich. So the sandwich exercise should be familiar to you. You can move your legs forward a bit and bring them together, yes, and spread your legs to the sides so you feel comfortable. What can you do here? Here, we're going to activate the flow of these muscles and relax them. Plus, you can also strengthen these useless cells, and that will also have a very positive effect on the forehead. So if you want to improve the tension in your forehead to boost blood circulation, make sure you do the butterfly pose. So what do? Basically, you place your feet together, let your knees fall to the sides, and feel your pelvic muscles stretching. After you feel that they've stretched enough, start doing these movements. Engage your pelvic muscles and do it 30 times so these muscles start to activate. Just do it vigorously, 30 times. And after that, continue to stretch and relax. And wait for your pelvic muscles to stretch. As you continue to stretch, you'll notice a pleasant relaxation also appears in your shoulder area. There might even be a feeling of warmth. All of this is connected to increased blood circulation in that area. If you relax, your shoulders will also slowly start to relax because there are a lot of blockages and tension in the shoulder and perineum areas, both emotional and physical, due to tailbone injuries or even generational trauma. Relaxation. Do you feel like you're starting to get the hang of the exercise? If so, let's start doing it energetically again, 30 times. In the framework of a single video, it's impossible to cover all the nuances. So if you want to look 5 or even 10 years younger, I recommend you to join my rejuvenation program. There I show many exercises that you can with your own hands right at home, so don't forget to join. What should you do if you can't do this technique? You can skip it. If you can, what you do is hold your legs like this, as much as you can at least by the sides of your toes, and spread your legs. This way, you open up your pelvis, and you can see that your perineum is expanded. And in this position, holding it like this, you just lie down and can slightly pull your legs toward you, that is, from the sides of your arms, and open up your shoulders. Why is this necessary? The thing is, all these muscles and fascia are connected only to the pelvic floor, and the pelvic floor starts to engage. This, among other things, has a positive effect on the sacrum and on the nerves that come out of the sacral area here, which innervate the pelvic floor and the fascia. That is, the fascia starts to slowly relax and stretch, and the muscles also begin to stretch. And if the muscles stretch and relax, then first, they can contract normally. We do it like this. If you feel your legs are tired, you can return to the neutral leg position and then lift and relax again. The pelvic muscles are on the side. This is a very good technique, and it gives a feeling of lightness and relaxation. And the fourth exercise, I'm showing the diamond exercise. In this exercise, you squat down, place your hands in such a way that your fingers rest on your legs and are spread out. What happens? That is, the perineum rises up like a rocket, right? The entire ligament apparatus, all the muscles are engaged. Even if you just sit in this position for a few minutes a day, you'll feel that all the lines of your face, the tendencies, change. You'll start to feel it rising in your legs and shoulder area. There will be a sense of openness and warmth in the perineum. And this relaxes the flow from the shoulders physically, emotionally, and improves blood circulation. On the exhale, we rotate like ice and start to relax it. The thing is, when you relax on the exhale, yes, the body rotates and you relax those muscles. It's like post-isometric relaxation. You place your hands like this. Keep taking deep diaphragmatic breaths so you feel your shoulder girdle releasing on the exhale. Feel how you take a very deep breath and sense as if your shoulder starts to reach upward. And now, when you've reached with your shoulder on the exhale, you start to lift the anal sphincter. That is, you lift the rectum. In other words, you start to lift the rectum. And you feel a tingling, that is, in the perineum, in the area of the anal sphincter, right? Hold this for 5 to 7 seconds while inhaling and breathe smoothly. Then you can just take 1 deep, 2 or 3 deep breaths, and again, spread your legs even wider to the sides on the inhale, and as you inhale, start to lift your elbows, the arch appears, and then relax. Do this in cycles, and you'll notice that this area will start to lift significantly. And so, by performing all 4 of these techniques together, you are working both the shoulder muscles, the level of deep tendons in the shoulder area, and it also affects the blood circulation of the internal organs. If you do these 4 techniques, your shoulder girdle will always be healthy. Well, dear ladies, please write about your feelings. I'll be waiting for your responses in the comments, and I will definitely read them. Well, that's all for today. Subscribe if you haven't already, and see you soon.